Well, affordable healthcare can actually mean a lot. And so your neighbors that come in to Feeding Tampa Bay, they'll see your provider here, with Suncoast. That in of itself will be able to provide a lot of services, but it also introduces them to the entire network. Whatever they need, they have a contact that can work that for them.
Right.
So they're not trying to do this all by themselves. And that can be just, as any of us that have been kind of caught up in the system, if you will, it can be difficult. But then you look at the mirror at night and you go, I made a difference.
Yet another Wednesday, my friends, for Stick a Fork in It. Welcome back. I'm really excited to introduce you to a gentleman that I met by accident, filling in for someone else at a meeting in Brandon, which was crazy. But the outcome of that has been incredible for our community. I want to introduce you to Mr. Brad Herremans, CEO
Hello.
of Suncoast Family Health Centers.
Yep, Suncoast Community Health Centers.
Community
Sure.
Health
Yep.
Centers, and we have our community health center downstairs here at Feeding Tampa Bay.
Yep, absolutely.
So let's tell everybody kind of how that came about.
Well, sure. Well, yourself and Thomas, of course, in Feeding Tampa Bay, and also some colleagues, in the area kind of mentioned, you guys kind of have similar missions, similar goals, similar objectives. Yeah. You need to meet.
Yeah.
You need to talk. And we did.
We did.
And the idea of integrating our healthcare system in with Feeding Tampa Bay just made perfect sense. Mm-hmm. So this last year, we made the first effort, to get that going.
In February,
opened it up, and it's been, I think, a tremendous success. Dr. Suba Madidi from Suncoast has been the first provider. Mm-hmm. He'll be retiring here in a little bit.
No.
He will, but this is like the fourth time he's retired, so I don't really anticipate him being gone.
We're crossing our fingers. Yeah. Everybody loves Dr.
Suba,
Madidi.
we love you. Come on back.
Yeah, and don't leave us.
Yep.
He's amazing, and I know that the families.
Yep, the new provider, Myra Espinoza, will be coming along. She's absolutely wonderful, and she loves seeing children, adults as well. And so there shouldn't be any misstep there. Right. But Suba did want to make sure that he personally got it going, and then he's been kind of bringing Myra along, and she's ready to step in and hopefully be your long-term provider here for many years to come.
It's really important for people who are struggling that seek out affordable health care, that they have consistency, much like the right to choose.
Sure.
Right? But actually building a relationship in a friendly, and a friendly face to your health journey, if you will. So it's affordable health care that people who come into our facility, and then we invite additional people, absolutely can stop by here, even if they don't come for food or other services. What does affordable health care mean, and explain the mission of your organization?
Well, affordable health care can actually mean a lot. And when you're kind of in this business, there's the healthcare aspect of it. But you hear the term a lot, social determinants of health.
Yes.
Of which obviously if somebody's having a difficult time getting something to eat, that would be a determinant to health. Of which Feeding Tampa Bay obviously plays a huge role in that, but you also play a tremendous role in other aspects of that. So like Feeding Tampa Bay, Metropolitan Ministries, organizations like ECHO, Suncoast Community Health Centers, all those types of services that are in the community, to include Hillsborough County, focus on the social determinants of health, that you start bringing that all together under the auspices of affordable health care. And to me, that's really kind of what it is. Okay. Now, obviously, financial barrier could be a barrier to health care. And so when you say affordable care, that's usually what people refer to. Our Suncoast Community Health Centers, we're not a free clinic. Obviously, it takes resources to operate the clinics. But we work with every family that comes in on making sure that the payer matches up with whatever their current situation is. Right. We'll try to get people on Medicaid. We'll try to get them on Medicare. We'll try to get them on an insurance plan. We'll get them enrolled in what they call the Hillsborough County Healthcare Plan, which people can get enrolled at right here at Feeding Tampa Bay. Those types of initiatives, all that fails, and we can't work that out. We'll offer a sliding fee scale based upon a family's ability to pay. And for us, a basic visit starts off at $40. So
some of us, that's our copay.
That's right.
Right. So I understand the lens of affordable health care that you're talking about, and thank you for putting it that way.
Yeah.
That is absolutely why we align, much like
Yeah.
people come in for food here and we want to offer them so much more to lift them
Sure.
holistically and wholly. It's very much the same.
You know, and navigating that system too sometimes can be
Yes.
difficult, and that's where hopefully we can be a help with that. Get people so that they're comfortable with, you know, what their health insurance or what their healthcare plan is. Understand how to kind of manage that, and understand what their health home is.
Right.
You know, Suncoast, obviously we want to be that health home, but more so than just medical, we do dental, we do behavioral health, women's health.
Right.
We have pharmacies, we have lab services, those types of things. And so your neighbors that come in to Feeding Tampa Bay, they'll see your provider here, our, you know, with Suncoast, and that in of itself will be able to provide a lot of services, but it also introduces them to the entire network.
Right.
So now they're, whatever they need from a
They have a
referral standpoint,
contact.
they have a contact that can work that for them.
Right.
So they're not trying to do this all by themselves.
Right.
And that can be just as any of us that have been kind of caught up in the system, if you will, it can be difficult.
Well, and it's overwhelming, which means they don't seek health care.
Right.
Which means when they finally do seek health care or dental
Yep.
or mental health,
Yep.
it has been something that could have been solved.
Right. Yep. So we want people to be comfortable. We want them to understand this is their health team. Their you know, they say medical home, dental home. That term's fine. I like health home. It's like, you know, when did the mouth become separate from the body? You know, it's kind of all one.
Yeah.
You know, so let's get those systems engaged, so people are used to going to the dentist. They're used to going for their annual checkups, those types of things, leading to exactly what you just said. If we can catch it early, we can hopefully help with quality of life, you know, going forward.
Absolutely. Along with healthy foods, along with, you know, sometimes that mental health aspect is knowing that someone's there for you,
Right.
To have the conversations, like what financially is affordable for you.
Yep.
How can we help you make sure you get the care that you need?
You know, and if nobody ever mentioned that to you or helped you with that, how would you know?
You wouldn't. You'd be
Right.
intimidated.
Right.
Much like folks are intimidated sometimes to come here and they shouldn't be.
Yeah. It's like, you know, because people hear about how expensive healthcare is. And so, you know, you hear that time and time and time again. You think, oh, my goodness, I don't have the resources. I'm not walking in there. I don't want to pay. I don't want to pay my rent check so I can, you know, go get
Right.
healthcare.
Right.
And so that's hopefully we can eliminate those concerns, help people navigate that system, and help them out.
Right. Tell me a little bit about what our clinic does here for folks.
Right now, it's primary care.
Yep.
It's family medicine. We'll be expanding that to pediatrics, having some children come in here in the near term. Ideally, hopefully, we'll start to add additional services, you know, as we move forward. Right now, it's primary care, and then obviously the referrals into the other areas. People want to have prescription coverages, you know, whatever pharmacies near them. They're welcome to go to any of the Suncoast pharmacies, but then if they're at Walgreens or CVS, you know, we'll just send their prescription there near their house, and they go pick it up.
Right.
Hopefully down the road we'll have some type of pharmacy service here, you know,
Right.
so they can just pick it up while they're here. So we're looking at ways to do that. Yeah, I know your team's kind of looking into that too, on kind of how that can work. You know, so eventually the plan long term is to have a full service community health center in with Feeding Tampa Bay.
Right. And we'll grow with the neighbors who come to us, which we've seen hundreds and hundreds of neighbors since February.
Right.
It's been a huge success here. That's something that folks can depend on. Monday through Friday, they know there's a place for them to go if
Yeah,
they
I think
need
total
us.
visits, you're up over 800, 900 that we've had so far, about 450 patients. And, you know, and the word's getting out, you know, and we'll just kind of continue to grow the business. And kind of hate to call it a business, but it kind of is, you know, but it's.
Grow the opportunity.
There you go. That's probably a better term.
Yeah. That's why
And-
they pay me the big bucks for PR.
Yeah, there you go.
I'm just kidding.
But and try to grow. If you grow it, develop it, you know, then it's there for everybody going forward.
Yeah.
You know, if you can't do that, if you can't make it a success, you know, then it fades, it goes away, and that doesn't do anybody any good.
Right. I'm really excited that we're adding, you know, everything takes a little time to grow in the right way, and that we're adding pediatrics because, you know, back to school, you know, kids need physicals, they need all these things. We have so many people coming into this building. It will be so convenient for them to do that all in one swoop.
Yeah, it's kind of funny you say that because back in our clinics, obviously the pediatric clinics are all ramping up, ready for back to schools.
Yes.
Very busy time for them. And
lots of toys, lots of stickers.
all the good stuff. Yep.
Right?
Yep, sure.
We have them here. We'll have them here too.
Yep.
How did you get into as just a professional?
Sure.
What is your career pathway? How did you get into healthcare? Because that's not where it started.
No, not really.
Yeah.
It was a long story short, but I ended up in the United States Air Force. I had my MBA from Western Michigan University. Came out of there years ago, long time ago, and ended up spent 22 years in the United States Air Force as a medical service corps officer. I was fortunate to, work my way, through that and retired at the rank of colonel. And when I came out of the Air Force, I was the commander of the medical unit in Malmstrom Air Force Base in Montana. A group of people that I truly loved, organization, very, very proud of the United States Air Force. Always be extremely dear to me. And then from that, obviously, relationships that I kind of developed in that kind of led me to Suncoast Community Health Centers. And so I started here in 2008. Worked as their chief operating officer for a couple of years, and then was fortunate enough to be selected by the board of directors to be the CEO in 2010, and I've been in that position ever since.
Well, thank you for your service.
Oh, you're very welcome. Thank you.
We appreciate it. We honor that and the sacrifices you made. You raised a wonderful family.
I did, and you mentioned sacrifices, and I'd be remiss if I didn't mention the sacrifices of my wife and my daughter. And there's a service member, but the family serves.
Yes, it's everyone, right?
Yep. Mm-hmm.
Finally, more about you. What motivates you?
I say this to the folks that I either myself or our chief operating officer speaks to every new employee that comes to Suncoast. Mm-hmm. Right now, we've got about 500 people that work for us, and we're fortunate enough to have a pretty successful community health center, here in Florida. And I'll mention them. Different things have to motivate different people.
Right.
Okay, everybody gets to work. You get a paycheck. Got to pay the mortgage. Got to pay the car payments. Okay, well, let's take care of that. But that really doesn't motivate you per se. But doing what we do, if you really, it'll probably sound, I don't know, cheesy, if you will, but if your motivation is to serve, all right, having an opportunity to work at Suncoast Community Health Centers, you have that opportunity, and I have it every day.
Yeah.
And so you look yourself in the mirror in the morning and go, I want to make a difference today. And you'll come back at night. Sometimes you'll be frustrated. You'll be tired. You'll be like, oh, my goodness, what happened today? And then, my poor wife, she gets to hear it. And then you look at the mirror at night and you go, I made a difference.
Yeah.
And I was able to put, whatever God-given talents I had to work that day. And you feel pretty good about it. And it must be because I'm still going at it. And
yes.
I plan to for the foreseeable future because I really, truly love what I do.
Yeah, it feeds the soul, helping people. And we thank you for your commitment to that, too, and for being a partner here at Feeding Tampa Bay.
Partnership's been great.
Yeah.
Your mission's incredible. I knew about Feeding Tampa Bay before. I should have known about it more than I did. But what you guys do is truly special, and I'm just proud to be a part of what you're doing.
Thank you. Thank you so much for joining us today. Mm-hmm. You guys, I hope you absorbed that information. There is a healthcare provider near you here in Hillsborough County, right?
Right.
You need to seek out Suncoast, and we'll put a link below so you can look for it. Don't forget to subscribe. See you next time.